Next, let's move on to certain fats, meats, and salt. Saturated fats and trans fats. Saturated fats, from fatty cuts of red meat, full cream dairy, butter, lard. Trans fats. In partially hydrogenated oils, many fried foods, margarine, packaged snack foods. Why avoid? Saturated and trans fats raise bad cholesterol, LDL, which can lead to plaque buildup in arteries, increasing heart attack risk. They also foster inflammation, which aggravates joint pain. Studies on processed meats and high-saturated fat diets show higher rates of heart disease and arthritis symptoms. Excess red and processed meat. Examples: bacon, salami, sausage, hot dogs, and large amounts of red meat steaks or chops. Why avoid? These meats often come with saturated fat, salt, chemicals, preservatives, in processed, which contribute to inflammation, higher cholesterol, and strain on kidneys, which in turn affects heart health. Also, joint pain may worsen. Compounds in red meat can increase certain inflammatory markers. Harvard-based reports link processed meats with worsened arthritis and heart risk. Too much salt, sodium. Hidden salt in canned soups, packaged sauces, fast foods, processed meats, condiments. Also, table salt. Why avoid? Excess sodium increases blood pressure, which increases risk of heart disease and stroke. High blood pressure also reduces blood flow to joints and can worsen swelling or fluid retention, causing discomfort. Mayo Clinic guidelines recommend keeping sodium intake below approximately 2,300 milligrams per day, ideally closer to 1,500 milligrams if possible.